Are you looking for professional training in forensic mental health?
The development of the MMPI-A-RF, which very closely mirrored the development of the MMPI-2-RF. So the MMPI-2-RF, just briefly, was released in 2008, so about 10 years ago, almost to the day. It was August 8, 2008. Even before the MMPI-2-RF, which was a restructured version of the MMPI-2, after which the MMPI-A-RF was modeled, even before that was released, they began plans for the MMPI-A-RF. But as things usually go, things take time. So it wasn't until 2016 that this thing was actually released. Some other salient differences between the A and the A-RF. Of course, this one is now 24 years younger, the current version. The primary influence of the MMPI-A, as I mentioned before, was the MMPI-2. So the MMPI-A-RF substantive scales, so 42 scales that measure some substantive clinical content, very much map on to the MMPI-2-RF scale set. For those of you very familiar with MMPI-A, you're not going to recognize a single scale here. Well, maybe some, but not much. Because they really moved away from the idea of measuring psychiatric syndromes. They now measure psychological constructs that are dimensional and transdiagnostic in nature. Very much along the lines of where contemporary psychopathology science is moving. Because we're not really thinking about these archaic diagnostic constructs anymore. Most of them probably don't even exist. So instead, we're looking at constructs. Like, for instance, I'll take anhedonia as an example. Anhedonia is a psychological construct that exists in maladaptive degrees in many different disorders. Most of us, when we think anhedonia, think depression. It's a core symptom of major depressive disorder. But anhedonia is also reflected in schizophrenia. It's reflected in avoidant personality disorder, social anxiety disorder. It's reflected in schizoid personality disorder. So these types of constructs that we're looking at are transdiagnostic. They're informative. They're informative from a psychological perspective, but they're not tied to any particular diagnosis. And that is not by accident. Because in self-report, particularly, no matter what instrument you want to use, people point at the MCMI. We love the MCMI. It's so great tied to diagnosis. It is not that greatly tied to diagnosis. Labels suggest they are. That's about where it ends. The MMPI was meant to be tied to diagnosis. But at least the MMPI developers decided, yeah, we're not doing a very good job at this, so let's abandon that altogether. The last segment of today is going to be focused on various case illustrations. Jim is a 16-year-old Caucasian boy. Was referred to competency proceed evaluation after the defense lawyer suspected he might be mentally ill. Again, very rare. Because Jim had voices telling him to harm himself, at least so he reported. The court ordered placement in a psychiatric facility pending formal psychological evaluation. Jim had been charged with sexual indecency with a minor. The victim was a 14-year-old girl. Unfortunately, I don't recall the exact circumstances, what he had done, beyond that there was some fondling going on. I remember there was not a full...
Was he hearing voices before he fondled her?
Yes, that's what he claimed. Yeah, no, well, that would be an important thing. He reported a chaotic upbringing with mother being drug dependent and unreliable. There was lots of arguments going on in his home. There was a lot of physical, emotional abuse by his mother while Jim was growing up. Also reported some physical abuse by other caretakers like step-parents. Let's take a look at this MMPI-A-RF. Is there any indication that Jim might have been honest with the test? Well, first place we look at are the validity scales. Do you remember what the first thing is we should look at? Cannot say. Raw score of 0. So there's no problems with unscorable responding. Next, we look at RIN, TRIN, and CRIN. Try to say that fast 10 times in a row. we should look at are the high order scales because it tells us where to start our interpretation. Which domain should we start with? EID, T-score of 80. It's the most elevated high order scale. Good job. That means we will interpret the emotional dysfunction domain first. All of the scales that belong to the emotional dysfunction domain.
To learn more about Concept's professional training opportunities, visit us at concept-ce.com.